Good evening. You're watching Bharat Voice. I am Ritika Acharya, and today we are having for you yet another session of myth busting concepts. Today we are going to talk about busting some myths around Ayurveda, which is our ancient Indian medicine. To discuss all this, we have with us Priyanka Shandilya, who's a MD in Ayurveda. She's a MD in Samhita and Siddhanta, and she practices Shuddha Ayurveda. We will understand from her what is Shuddha Ayurveda, and we'll try to, address certain misconceptions, certain myths around Ayurveda, and try and understand from her as to what is it that people believe is Ayurveda only like a immunity busting, immunity booster, or if you have serious problems, if you have surgeries, or let's say if you have an accident, if there is a bone problem, can you still go to Ayurveda and can you still take the help of Ayurveda, or you need allopathy in that case? Priyanka Shandilya, thank you so much for joining with us on Bharat Quiz.
Thank you, Ritika.
Okay, so Priyanka ji, before I ask you all the common myths and misconceptions around Ayurveda, I still want to understand. You say you practice Shuddha Ayurveda. What is Shuddha Ayurveda?
So this terminology is not a classical terminology. Like you don't find
Mhm,
this Shuddha Ayurveda term in the classics, like the Samhitas,
mhm,
but it is the way you understand and bring Ayurveda to practice. So when you say a practitioner is practicing Shuddha Ayurveda, it means the practitioner is analyzing and understanding a patient's condition, diagnosing it on the lines of Ayurvedic texts. So this point
mhm.
is really important. So,
Okay.
if a person is diagnosing a particular condition based on the lines of diagnostics of Ayurveda and
Mhm.
employing treatment methodology or modalities as mentioned in the Ayurvedic text. So,
Okay.
when I say as mentioned in the Ayurvedic text, it's not
Mhm.
selective choosing of the drugs or selective choosing of the therapies. It is
Mhm.
the sensible and timely application of these modalities in the right
Mhm.
avastha of the disease. So it is not using herbal medication in place of English medicine or allopathic medicine, synthetic
Mhm.
drugs.
Mhm.
So when a person practices this, that is, when he diagnoses it on the lines of Ayurveda and treats on the lines of the text treatises,
Mhm.
then you can call that as Shuddha Ayurveda. So
Okay.
mainly the
So then,
diagnostic treatment is important.
all right, all right. So, Priyanka ji, I have to ask you that you write as well, and you write many blogs, and you write many articles as well, and I've read a couple of them. So, in those articles, you have mentioned, and it was very intriguing for me because
Mm,
nowadays, there is a culture of fasting. Okay,
mm,
everyone's
mm,
now talking about intermittent fasting and how it can help you reduce
yes,
weight, how it can help you boost your immunity, and fasting is good for all of us, and we should go on a honey water fast, this, that. But you in your article say very clearly fasting is not meant for everybody. And you need to understand your body type first. So please
mm.
elaborate on that as to why is fasting not meant for me? Because, till now I used to feel that, if I fast, let's say for 20 hours, it's probably just going to help my body, right?
Yeah. I think it's not just the fasting, but any other practice or advice. So it is tagged
Hmm,
with so many misconceptions, like fasting. So
hmm, hmm,
when we say, when a therapy or when a recommendation from
hmm,
from Ayurvedic side is going to help a person, then it means that
hmm,
we should be considering the condition of that person. So by
hmm,
the word condition, it doesn't necessarily mean the body type as it is believed commonly. So of course,
hmm,
that is
hmm,
only partially true. That okay, a person of Vatic body type or Vatala
hmm,
dosha prakriti, that is what is the
hmm.
term. So he might not need or he may need. So
Okay,
only as for a transient period, as an
okay,
avasthika chikitsa, he may need. And
okay.
a person of kapha dosha, even if he does it for a long time, it may not harm. Again, it is not hard and fast. May not harm. So it is
Hmm.
not purely on the body type that one should be deciding whether one has to go on fasting or not,
So
but it is
then what is
on.
it?
So it is on. It is mainly depending on the person's agni and like
Hmm.
how bad or good agni is, and very
Oh,
importantly, the doshic
uh-huh.
state and state of dhatus in him. So this
Hmm,
whole
hmm,
fasting that has been mentioned as a treatment modality
Hmm.
in conditions
It's,
pertaining
so
to
you're
the
saying it's
cold.
not just the body, it's not just the body type. You may be a vata or a pitta or a kapha. It's not just that. You need to understand the dhatus in the body, and you need to understand
Yeah,
how is your agni. What does
yeah,
that
and the
mean, Priyanka?
bala. So I'll just give you an example of a fever. So that is, or an episode of indigestion, which is very commonly encountered these days. So we actually advise a person,
Hmm.
if we are doing it on a avastic basis, it's just a transient this thing, and it is not regular, and we will not be advising it periodically. It is just an avastika chikitsa. So in a patient, if we diagnose that patient as having kapha jejvara in samavastha, so these are technical terminology, and the strength of the person also is good. So
Hmm.
we grossly, like these are the few important factors that I'm listing. There are many other factors. So then
Okay.
we diagnose that particular condition on these basis, on these factors, and then we advise that person to hold fast for a stipulated period of time, or
Oh.
till appearance of certain lakshanas, which will indicate some kind of a change in the body. So if
Hmm.
it
Hmm.
is
Hmm.
done for a longer time, so it is quite
Hmm.
commonsensical that it is definitely going to harm you, because
So,
you can't,
so
you
basically,
sitting
what
at
you're trying to say is that obviously understanding your dhatu with your agni and many other factors, which only a
yeah,
doctor can tell you, and then a
sure.
doctor tells you that for a stipulated time that you should be
Hmm.
fasting, not like do
Yes.
an intermittent fast, which is prescribed
Yeah.
on which is not prescribed by doctors, which is just floating around
Yes.
on the internet, which has become a fad nowadays. Don't fast 20 hours. Let's say, for
Yes.
example, I'm telling you, Dr. Pranka, that
Hmm.
I am a high pitta person. So then that means,
Okay.
and whenever I tried fasting, no, I have felt
Hmm.
that I have massive headaches and that my
Okay.
body is not accepting it. And so therefore I've
Okay.
understood my body type and I've understood that probably I should not be fasting. Have I
Yes.
understood it correctly? Is that what you're trying to say?
It might be partially correct, because there are two aspects to it. One is the dosha, which decides what prakriti or dosha prakriti you have.
Hmm.
So that is
Hmm.
basically your nature. So that is one aspect of it. Sometimes, there might be pitta in your vikriti. In your
Okay.
condition, there might be aggravated pitta and also even vata. So it might
Hmm.
be a condition of vata paitika condition, and maybe the toxins may not be in the koshta.
Hmm.
So
What
that
is
is that
uh,
becomes the primary. Okay, koshta, a gross translation. It's not an equivalent, but a gross translation to that is GI. You can roughly consider that as GI. So when the toxins are
okay?
not located in GI, and all these things like dominated with vata pitta, and maybe there
Hmm.
is no ama, maybe. So in such
Okay.
conditions, it is actually going to aggravate the problem. So maybe that is the reason why, with the dominance of vata and pitta, you're getting that headache.
Okay, okay. Priyanka ji, can I request you for because you're using a lot of heavy Ayurveda,
Hmm.
very lot of Sanskrit
Hmm.
words, and our
Hmm.
viewers may not understand it. So, if
Hmm.
you can use slightly easier words, so it's easier
Uh,
for us to understand in general terms, if it's
Okay,
possible
sure.
for you.
I'll try
Okay.
to. Yeah, I'll try to.
Okay, so I'll move on to the next thing. And again, you mentioned in your articles, in your blogs, that there is a particular time to eat sweets. Now, of course,
Hmm.
all of us practice this, simple thing that we have to eat a sweet after eating a meal, and it helps
Yeah.
your digestion. All these years, for example, again, I'll give my example. I've been eating a spoon of jaggery
Hmm.
after my meal. But
Hmm.
you say that a sweet is preferred. Actually, a dessert is actually better to be eaten before the meal. So, have I been doing all these years a wrong practice, and the sweet should be eaten before the food? What is it?
Yes. So I think it is wrong.
Hmm.
Like any advice like fasting, or the whole meal pattern, the
Hmm.
exercise, any other lifestyle practice that we are doing today, including eating. So it is
Hmm.
all based on something called as Agni, which roughly translates to the metabolizing factor or the
Right.
digestive factor in us. So we,
Right.
in every nook and corner of the body, have got Agni in us.
Hmm.
So mainly it is located in the GI, but it also
Hmm.
has its amshas or portions everywhere else. So it is
Hmm.
the one that metabolizes things. And
Right.
this dessert in the beginning pattern, that is dessert and main course. So that
Sweet and
pattern
sweet
is
in the
mainly,
beginning.
yeah, sweet in the beginning. So that
Hmm.
pattern mainly is meant, to maintain the homeostasis, mainly concerned with the vata pitta kapha. So it is in the
Okay.
beginning stage of a meal, when you're on empty stomach, when you've not yet
Hmm.
started your meal. It is the
Hmm.
vata and pitta which are in dominance.
Hmm.
So it is the vata and pitta and the dominance towards the middle when you start eating, and once there's
Hmm.
you eat something, the
Hmm.
pitta starts its role. It starts coming
Right.
into play, and towards the
Right.
end of the meal, it is the kapha
Right.
which takes power. So vata, pitta,
Right.
kapha. So in Ayurveda, it is the madhura rasa. So it is the sweet taste, roughly the sweet taste. It could be sweetness of the jaggery, it could be sweetness of sugar, it could be
Yeah.
sweetness in the rice, it could be
Yeah.
sweetness in something else, in a fruit.
Yeah.
So that
Yeah.
rasa should be ideally taken in the beginning, which will automatically pacify the dominant vata, which is dominant in the beginning of the meal when you're on
Mm-hmm.
empty stomach. So that is
Mm-hmm.
exactly why you should also, like, you can also be eating a heavy substance. So like a
Hmm.
ghee rice or payasam in South Indian this thing. It's a payasam. It's both heavy. It is unctuous. So that will actually, in the Kindle state of Agni, you've not
Yeah.
even given anything. It is ready to, consume everything. So it's
Yeah.
in the
Yeah.
powerful state. So in that
Yeah.
state, you should be you should be offering that fire with something heavy, unctuous. So the equivalent to that is Madhura Rasa. So that will
Oh.
automatically, yeah, pacify the
You're
Vata
saying
Pitta.
that
But when,
so you see when the Agni is very strong, when you start eating,
Mhm,
that
mhm,
time you actually give your Agni something which is a heavy substance, something which
mhm,
is difficult or takes a longer time
mhm,
to digest, and that would be preferably a sweet. So rather than
yeah,
eating a sweet in the end of your food,
mhm.
you actually eat the sweet before your food, is what you're saying. But
Uh,
to
not before, but it should be at the beginning. So there shouldn't be a gap,
the
as
beginning
it is
of your
healthy in the
at the
beginning.
beginning of your
And
meal.
when you're, yeah, and when you're eating that, something like the curds or some sort of a
Hmm,
typical dessert recipe,
hmm,
at the end,
hmm.
it is actually going to increase the kapha, which will actually
Oh.
impair the digestion. It's not helping it, but it is actually
But
harming your body.
Dr. Priyanka, many people will actually claim that, I'm actually feeling better after eating a sweet substance after my meal.
Mhm.
And I've been doing this for years. So how is it that, Dr. Priyanka is saying that, you should be eating a sweet before your meal, right in the beginning? So many people
Mhm.
say that, oh, my food feels digested. I feel much better. So then, is this just like
So
a placebo?
yeah, it is like it is not even a placebo because it is actually having an ill effect on your body. So maybe the answer is you're pleased with eating sweet recipes. That is one, and this is not what I'm analyzing. So this is
Hmm.
the reference that I'm quoting from Sushruta Samhita and Ashtanga Sangraha.
Right,
So
right,
it has
right.
been documented. And one important thing is you may not feel the harmful effects immediately. So
Hmm,
any
hmm,
even if you eat something, it will definitely have an effect on your body. Maybe you're
hmm,
not
hmm, hmm,
aware that it is because of that.
hmm,
So,
hmm, hmm,
and
hmm.
as you rightly said, like this is jaggery, it may feel good, but it is also for a regular use, that too especially in Bangalore, in a locality like Bangalore.
Uh-huh,
So
uh-huh.
it may be causing something called as abhishyanda, some phenomena, and when you're especially taking it at the end. So
Hmm.
in the longer run, it is definitely going to cause some or the other problem. Maybe you
Okay,
won't know that it may be because of that. Yeah,
okay.
you won't
All right.
attribute it to that.
All right. Okay. So I have to come to this, another question, which is a very serious. I would say it's a serious question because recently it's been like a talk of the town. Many people are talking about the use of cannabis, and I'm asking
Hmm,
you this because people say that certain psychosomatic disorders, certain mental disorders, certain depression-related issues can be treated with the use of cannabis or marijuana.
hmm.
Does our, ancient science, our Ayurveda, which is the Upanga of Atharva Veda, does it at all mention the use of cannabis in the treatment of any disorders or any psychosomatic disorders per se? Or is that just a Western thought?
So it is a Western thought, and I also think that maybe that is influenced by in the effort of drawing parallels between okay, modern science says something. We also have something of similar sort in our science. So
Hmm,
because
hmm,
they use tranquilizers and sedatives in the psychiatric disorders, maybe
hmm,
in that effort, maybe this idea would have come into picture. But Ayurveda clearly, so I think if I could give a glimpse of what mental disorders are as per Ayurveda, then maybe it would be
Okay.
clear. So,
Okay.
mind also, the so-called mental disorders, so that we brand as psychiatric disorders, are not purely mental.
Hmm.
So, any disorder can have association. So, a psychic disorder will and can have association of the soma, that is the body. So, there is
Yeah.
always this interplay, constant interaction between the body and mind, and also the doshas,
Hmm.
mental doshas and sharirika doshas. So,
Hmm.
the so-called depression, anxiety, or bipolar
Hmm.
disorder, whatever it is, so they are
Hmm.
not purely psychic,
Hmm.
according to Ayurveda. So, you may
Hmm.
be seeing the symptoms at the level of psych. The presentation, clinical symptoms are there, but the disease is also very much physical, because the whole
Hmm.
process behind that presentation, that is we call as pathology, that essentially involves the involvement of both bodily as well as mental doshas. And
Right.
mind also is active at both planes. Mind also,
Hmm.
even though it is an abstract thing, it is actually active at the physical plane also. It is five elemental, it is panchabhautika. So that
Okay.
is why what you eat is important. So
Right.
the whole treatment protocol in Ayurveda revolves
Hmm.
around this, and it mainly,
Hmm.
in the initial levels, it actually tries correcting the physical portion of physical layer of the mind as well as the body, because they are
Right.
actually causing these mental illnesses. And
Right.
in that description, we don't have reference of either bhang, which is cannabis sativus, or marijuana. And very importantly, bhang.
Vijay, I'm so sorry. I have to stop you because I think there's something wrong with your internet because your video has completely paused. There are a lot of people who are listening to this very interesting discussion, and you came to the point of bhang. Can I please request you to join in again? Is
Sure.
that possible?
Yeah,
Yeah.
yeah, I'll try.
So, for people who are watching us live on Bharat Voice today, we're talking about a very interesting discussion and busting some myths around Ayurveda. We're talking to Dr. Priyanka Shandilya, who is the MD, and she is joining us from Mysore. And we were right now discussing a question on, is it possible that, just a second. Okay. So,
Ritika ji, can you see me?
no, your video is off, Priyanka ji.
Okay, I'll try once again.
Yeah. So Priyankaji was talking to us right now about the use of cannabis, and does our Ayurveda, our traditional Indian medicine, anywhere mentions the use of cannabis and the treatment of psychosomatic disorders for that? So she was describing it, and she was also telling us, yeah, yeah. Now you're there.
Okay.
Okay. So for people who watching Bharat Voice, we apologize because we live in a technology world right now, and so if there's any hiccups, so we apologize to you. Also, Priyanka ji, there are certain questions coming in. Uh, this is a question from Shillong Suresh. So he's saying, can you tell me something about Kizi therapy? Is this related to Ayurveda?
No, I've not heard about that. Maybe I
Okay.
can give a feedback later.
All right, all right. So we'll also help you connect to Dr. Priyanka. So if you have any questions with her, she'll be on free to help you. All right. So there's another question from Vishal Vyas. He says, does Ayurveda help in curing any disease which is at the last stage? For example, kidney at fifth stage or something. So this was going to be our question, Priyanka ji, because I was going to ask you what happens in the case of cancer. Of course, in our news and everything around us, we've mocked Ayurveda enough, saying that how can you have cow urine and then you treat cancer? How can you have such regressive treatments and such? But I really want to ask you that, is it possible to really treat very serious diseases through Ayurveda?
It is definitely possible to treat serious illnesses. So, but
Hmm.
the question related to whether Ayurveda is effective when it is in terminal stage, again, the definition of terminal changes. You know,
Hmm.
many a times it happens so that the conditions which are tagged as being terminal, final stage, have been reversed in
Hmm.
Ayurvedic treatment. But here I'm not, in any way say making hollow claims that you can treat anything to everything on this earth through
mm,
Ayurveda,
mm,
because Ayurveda itself has mentioned certain points which actually tell us about the prognosis. Before you
mm,
consider the prognosis, you're not even supposed to take the patient, accept the patient for
mm,
treatment.
mm,
So if
mm.
the lakshanas, or if the clinical presentation, mainly the strength of the patient, his digestive fire, and the condition of the dhatus. So if they are in good condition,
Mm.
like good in the sense in terms of Ayurveda, so
Yeah.
then it is possible we can
So it is
at least better the condition. But it's not
seeing
like
the
you
seeing
can treat every single disease on this earth.
mm,
It is not that. But I can
right,
definitely say that 80 to 85% of every or all the illnesses can be effectively managed with Ayurveda.
right.
This includes
Even
even
if,
serious
even if it
illnesses.
is at the last stage, seeing the strength of your body, also seeing dhatu and seeing other things in your body, other elements which only a proper doctor can tell you, Ayurveda practitioner can tell you. Seeing that it is possible, you're saying, to some extent, to even treat a problem which is at the final stage.
Yes. So the definition of terminal changes.
All right.
That
So,
has.
now coming to the interesting question that we were on, and the internet went off. So I was asking you,
Bhang.
is
Okay.
cannabis really helpful in treating mental disorders, psychosomatic disorders? And you were coming to the point of bhang. What is the use of
Yes.
bhang, and what do our texts mention about this? Can we use bhang? Because it's now it is not overused; it is misused. So, where do we draw the line?
I think in context of these termed mental illnesses, there is no mention of bhang or ahifena,
Hmm.
the cannabis, that is
Hmm.
cannabis sativus or marijuana. So there is no
Hmm.
mention of that. Of course, Bhava Prakasha and other later texts do mention about bhang, but
Hmm.
in the treatment of mental illness, it is not mentioned at all, because
Hmm.
earlier I was talking about how we look at mental illnesses. So
Hmm.
it definitely doesn't mention bhang, because that bhang actually increases the moha and mada. It is actually going to intoxicate the person. So that is what is told in the Bhava Prakasha. Moha,
Okay.
mada. So mada is intoxication, or it is slowing down of the activity, or diminishing the
Hmm.
activity of
Hmm.
intellectual
Hmm.
faculties.
Hmm.
So which is
Hmm.
the case in these mental disorders. So that is
Okay.
definitely not the way of going about treating mental illnesses. Bhang.
Right.
So that
Right.
doesn't find a mention, at least in the context of mental illness. So it is,
So
of course,
cannabis is
constipation.
definitely, according to Ayurveda, cannabis is definitely not recommended to treat any sort of mental disorders or
Mental, no.
psychosomatic disorders.
Yes.
Okay. Okay. Great. Also, coming to this question about, we cannot deny, Dr. Priyanka, and you must be, experienced in this because you must be getting many cases related to hormonal imbalances. So they're so rampant in today's times, both in women and men. And I was reading somewhere that, one in every two women are now having hormonal disorders, and because of that it eventually leads to women not being able to conceive and so many such problems, basically because of the food that we consume, or the milk, or the food, or the whatever we are eating around us. And I really want you to tell me as to what can we do about these hormonal imbalances, because of course you're going to tell me that our lifestyle needs to change. It's not just we start
Yes.
taking ayurvedic medicine and then suddenly we feel okay and everything is fine. But what exactly is like a long term answer to this?
There definitely is a long-term answer to this, and as you rightly said, it is not just the lifestyle. It is more so the food, the kind of food, and the choice
Yeah.
of food that that you're making. Because naturally, like we have the tendency of blaming it on the pesticides.
Hmm.
We are not
Hmm.
getting Shuddha Ahara, but that
Hmm.
itself is not the whole complete story. Because
Okay.
what you're eating is also important. So it's like hormone, you can't be comparing it to one or two components in the body, because when your body is in the state of homeostasis, functioning normally, when different components, so dosha,
Hmm.
dhatu, agni, mala, so when all these
Hmm.
components are in normalcy, in equilibrium, not equilibrium, but when they're performing their functions in up to optimal
Hmm.
level, so the
Hmm.
hormones also will be
Hmm.
secreted in the optimal levels. So through
Right.
Ayurveda, we try bringing the system back to the normalcy. We start
Hmm.
reinstating those lost equilibrium or lost functioning of the organs. It's not
Balances.
supplementation. Yeah. So it's not
Okay.
supplementation because that
Hmm.
cannot be a solution. So
But then,
we are actually making the body correct itself so that it
hmm.
can, yeah, it
But then,
can produce
that
whatever is
a very
needed.
natural, to that a very natural question comes, Dr. Priyanka, that if I'm taking Ayurveda, I do not have so much time. Ayurveda is such a slow practice. How effective is it? Is allopathy more effective or Ayurveda more effective? It's going to take so much time for me to, correct my own body or my hormonal imbalances. What do I do about it? This that slow thing that is often associated with Ayurveda. How do you counter that?
I think we need to define the disease first, whether it is acute or
Yeah,
chronic, before we,
yeah.
decide on whether or not Ayurveda is slow or fast, quick
Hmm.
acting. We
Hmm.
have to look at the nature of the disease, because, of course, hormonal changes, even you not, supplementing it with the external, not supplementation, you can still be correcting it, but for the body to get used to that and for the body to correct itself completely, it definitely needs certain amount of time. But that is not the case when you're talking about an acute illness. So Ayurveda
Hmm.
is definitely not slow because there are many instances wherein we see changes within minutes to hours.
Hmm. Hmm. Hmm.
It is that fast. So I think it is basically the nature of the illness which decides how
Hmm.
fast or quick
Oh,
you
that's
could
very
expect the
interesting.
result. Yeah.
That's very
So
interesting
I think
because people may end up believing that for a very acute illness, it's best to go to allopathy and just treat it then and there. And but you're saying that actually it's very fast. Ayurveda is very fast, especially when it comes to an acute illness, because you could see changes in your body and you could see like a relief in your body within like hours, a matter of days.
sure.
Okay, all right. I also have to ask you, Dr. Priyanka, about, again, people often ask that, I have like a bone or a muscle injury
Hmm.
or a nerve injury. How is
Hmm.
Ayurveda going to help me treat that? Because, the common misconception and the common belief is that if something like this happens, if you break your bone or there a muscle injury or a ligament injury, you have to quickly rush to an allopathic doctor. How can Ayurveda help in that situation? And I honestly haven't heard of anyone, rushing to an Ayurveda doctor in that situation.
Yeah. So again, we have a few practitioners, like maybe one or two practitioners, who actually
Hmm,
even treat acute fractures in the acute stage.
hmm,
There are many such clinics which actually treat these RTAs and all, which help reduction and all. But but it's not that rampant and it's not that prevalent also. It's not very common that you see fracture being treated. But definitely, once the acute phase is done, once the
okay.
reduction and that is done, uh, Ayurveda can definitely help in the regrowth and effective
Hmm,
getting back to the normalcy of that condition. So there is
hmm,
no doubt about it. But there are
hmm,
a few practitioners, Ayurvedic practitioners, who even do it in the acute phases also. So in some
hmm.
parts of Maharashtra and some parts of Kerala, so there are practitioners, but that's not a common sight. So that I
Okay.
have to be frank about that. That's
But
not a
but
common.
but according to our science and according to our history and ancient Indian history, it is very much
Yes.
possible to treat these
It
things,
is very
though
much possible.
it
Yes.
is very much possible, though it's not very common. But you're saying that in a regular scenario, if you have a bone or a muscle injury, you can what you can do is you can consult a doctor. But for the regrowth period and the recovery period, it's better to rely upon natural things like Ayurveda.
Yes.
Okay,
Sure.
all right. Also, another question that has popped up from Preeti Sharma, which is how can we involve Ayurveda in our daily life, in our day-to-day life, to improve the quality of our life? Now, this is just like tips you can give as to what can we do in our daily lives to have a healthy lifestyle.
Okay, it's slightly difficult, but what you can do is practice a healthy food habit. So
Hmm,
uh, again, it's going to be very broad, because a food article which is good for you may not be good for another person. But
right.
generically, if I have to say, you have to maintain that regularity in meal, and it is
Okay.
also very advisable to be having your dinner before 8 o'clock,
Hmm, hmm,
at least by 7:30. So it is,
Hmm.
because that is the system is governed by the solar
Hmm.
and lunar
Hmm. Hmm.
aspects. So that is one thing, and it's not about employing dinacharya or rutacharya, because again that
Hmm.
also needs to be customized. Like
Hmm.
daily use of massage also is not very advisable, because
Hmm.
every advice has to
Hmm.
be in accordance to your condition, your specific
Hmm.
condition. So,
Hmm.
but overeating, eating frequently, you have to
Hmm.
divide your meal. So all that is a myth. At least Ayurveda doesn't subscribe to it. So
Hmm.
at
Hmm.
least, if possible, if you have the practice of having only 2 meals a day, that is one in the morning and one in the evening. So
Hmm.
that's the best practice. But as we have come so much far from the roots, so we
And
have now
definitely,
3 meals.
and definitely not skip any meals, because some people have a practice of skipping dinner if it they think that it's I've had like 2 meals, so it's better not to have the third meal, better not to have dinner, and it's 6 o'clock past, 6:30 past, so I'm not going to eat anything. So you're saying that have a meal, have your dinner, have the third meal, but have it before 8:30 max.
Yeah. So if everything is fine, if your digestive system and condition is fine, you can
Okay.
still be having three times. One is breakfast
Okay.
and 2 meals. But
Okay.
I can't be giving generic advices. And about
Hmm.
water, I think we are going to discuss. So let's
Yeah,
keep it.
yeah. So that I was going to come to that, because now what happens is drinking water after a meal, also
Hmm.
drinking water throughout the day. You talk about,
Hmm.
again, in your article, in your blogs, you talk about what is the right quantity of water we should be having and when should be having that water. So if you can please elaborate on that.
So first thing is there cannot be a definite quantity of water. You can't say
Hmm.
that you should everybody of us should be having 2 or 3 or
Hmm.
up to 5 liters a day, because
Hmm.
every one of us, like, we are unique, and the
Hmm.
bodily needs also is unique. The amount of kledha or the amount of moisture in you is
Hmm.
definitely different from what I have.
Hmm.
And
Hmm.
drinking water whenever you feel like, or just because it is good, it is definitely bad,
Hmm.
because that's a very wrongful practice, because it is actually
Hmm.
going to harm your digestive fire.
Right.
So, sometimes you feel the changes happening in you immediately.
Hmm.
The body starts repelling it so badly. But sometimes
Hmm.
some people who are not sensitive, they don't understand. But there
Hmm.
is the fluid buildup in the body. You may not see it in the form of edema, but definitely there is a
Hmm.
fluid buildup, unwanted, when it is not getting metabolized properly.
Hmm.
So when
Hmm.
you're having your meal, it is ideal to be drinking water after 2 or 3 boluses. A small
Okay.
sip of water after each bolus, or in the middle of a meal.
Priyanka,
So that is
Priyanka
the
ji,
ideal way.
I'm so sorry. I'll have to request you to join again, because again we're having
Okay.
internet issues. I think at your end, because the video has gone off, and yeah. Okay, so we were discussing with Dr. Priyanka Shandilya as to when is the right time to have water, of course, and what is the right quantity of water. Because as she's saying that you cannot have 10 to 15 glasses of water every day, and it cannot, one size does not fit all. So we cannot do that. We cannot be drinking water all day long. For all you know, your body does not even require that much water. Dr. Priyanka has joined us again. Yeah, please elaborate on the water point.
Yeah. So
So
it's
what happens
also,
when you drink water? Is there a water retention in your body or what?
yes. So you may not be able to see it, in the form of edema, that is swelling,
Mm,
or you may not
mm,
be that may not be very evident. But
mm,
anything which is used in excess is definitely going to create problem. So at the very earlier stage, it is the agni or the digestive fire that is getting impaired. So
mm,
even so it is ideal way of drinking water is in the middle of a meal, and whenever you are thirsty. So thirst is something which can be an effective indicator, or which can tell you how much of water you need. So
mm,
again,
mm,
there is again a clause to it. When there is
mm,
excessive thirst, because in pathological conditions, also in abnormal conditions, you have a
mm.
lot of thirst and dryness in your palate. So, but that
Right.
doesn't mean that you should be drinking too much water. That is vikriti, or that is some problem is there in your body which needs to be corrected.
Mm.
So
That
on
that's
correction of
exactly what happens. That's exactly what happens with me, Dr. Priyanka, because I can only talk for myself, because I have a habit of drinking a lot of water because I feel regularly very thirsty, and if I don't quench my thirst, I feel rather uncomfortable. So then, what sort of a dosha does it talk about in my body? Is there a
um,
problem?
Yes, I think it is again. It comes down to vata pitta probably. So
Vata Pitta. Yes,
so on. Yeah.
that's what I have. I have a Pitta and a Vata.
Okay. So maybe there is some sort of vikriti in that. So
Hmm,
that will actually causes dryness and
hmm,
also
hmm.
the water which you've consumed, if it is not getting used up properly, because you're
Ah,
giving your body with enough water, but it is
ah,
not going to places where it has to, and it is not
right,
getting assimilated. So the
right.
digestion and assimilation of even water is so much key.
Hmm,
You're actually drinking more than what you actually need.
hmm, 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 hmm.
So
Okay,
that is why
okay, all
I think that needs to be corrected.
all right. Now I'll come to okay another question. Interesting people asking questions. There's another question which is uh, can Ayurveda help in reducing belly fat or weight loss? Because this is something that people think that how can Ayurveda help me lose weight? Is it going to help? Let's say I want to lose weight and I want to obviously get rid of my extra fat. Can Ayurveda help me with that?
Yes, Ayurveda can definitely help you with that. But you need to be very careful about what you're doing to do that. Like what
Hmm,
method you're adopting for that.
hmm,
Like
hmm,
weight reduction programs, which will drastically reduce 5 to 10 kgs. 5 kgs still better. 10 to 20
hmm,
kgs. There are many programs which do that over a period of
hmm,
6 months. So that is something which
hmm,
is harmful. And there is
hmm,
a method or there is a protocol which has been laid
hmm,
out in Ayurvedic text, which will help you lose fat, so unwanted accumulations. But it is
hmm,
important that how you do it. So mainly it
hmm,
is through your diet. So cutting down some aspects of your meal, maybe in the form of pishtahara. So there are many other things, curds, and
okay.
so many other things. So by reducing those, cutting down those items, you can definitely keep your metabolism up, so which will
Right.
prevent further accumulation.
Right. At the same time, Doctor, I have to ask you. There are more questions coming in, but I'll take those questions in a bit. I have to ask you about the phases of the moon. Now,
Hmm.
how do the phases of the moon affect our body? For example, some people say that they get regular headaches during a time of an eclipse. They get headaches during the time of, let's say, Ekadashi or Amavasya or something like that. How does that affect people, and does it affect a woman's body more, or is that just another misconception?
No, I think we don't have a direct reference as to getting headaches during grahana, but
Hmm,
definitely we have, like, there are many references scattered throughout the Samhitas which talk about the relation between universe and us. So we have three
hmm,
forces in the universe: moon, sun,
hmm,
and wind. So we are the miniature representation of those forces. So
hmm,
any change in those celestial bodies will definitely have an influence on our body also. And more
hmm,
so when you're talking about Ekadasi headache and all, that probably may be periodical headache. So that may have
hmm,
one thing is it might have coincided with Ekadasi.
hmm, hmm,
So there are conditions which is mentioned in Ayurveda, wherein a person gets headache with a regular periods,
hmm,
regular intervals,
hmm,
maybe once in 10
hmm,
days, once in 15 days,
hmm.
once in a
Yeah,
month. So there
yeah.
is mention of that. But again, you have to, maybe the grahana and headache, there may not, as far as I know, there is no direct reference of grahana and headache. But
But
the reference of
in general,
eclipse,
the phases of the moon affecting, let's say, not just your headaches, but also
definitely,
your digestion and your
body.
body in general.
That's a sure thing. And
Hmm,
the lunar and solar movement are actually affecting you on a regular basis.
hmm,
In the
hmm,
day, it is the sun which is predominant, and in the
hmm,
night, it is the moon. So,
hmm,
so that I think that is why you call lunatic, no, like
hmm,
lunar
hmm,
cycles, lunatic.
hmm,
So, moon also is a representation of mind in us. So,
hmm,
and we have certain references which talk about certain kind of afflictions on particular days. Ekadasi,
hmm,
Trayodasi. So
hmm.
maybe these conditions correlate more towards the ones that I mentioned. So, and
Okay.
also Ayurveda says that grahana or eclipse days shouldn't be considered for study purpose. So that definitely says that that has an untoward effect on humans. So definitely it will
Why
be
is it
affecting.
should not be
So
used for study?
study purposes. So that has
Why
been
is
specifically mentioned. Like any during the grahana, the dharma which is operating in the universe is not conducive for the study purpose. We talk about
Okay.
Brahmi Muhurta being very conducive. There is a lot of sattva guna in that. But in Grahana, it is actually one celestial body is actually suffering, it is being covered, avarana. So, so any change in the universe invariably reflects on us. So maybe some are more sensitive to it, or the body condition is so that we start expressing
Your
certain
body,
conditions.
okay,
Yes,
some people may be more sensitive to it, and obviously it definitely affects your body. It may affect your digestion or headaches or something else, but some people are
sure,
more prone to these things.
sure.
Okay, all right. There's another question that has come in. So somebody is talking about, sexual problems, and someone's saying that, can those be treated through Ayurveda?
Yes, certain kinds of problems can be treated. Again, we need to take the history, whether it is genetic or, there are many conditions which are not believed to be genetic in modern science, but are, having the karmic roots. So if it is one of that, that has to be first elicited. And then the Ayurveda talks about, a plethora of such disorders. So Ayurveda definitely offers an effective cure.
Hmm.
So again, it
No,
depends on the condition. Yeah.
because Dr. Priyanka, I'm asking you because when people talk about disorders or problems, there's a quick fix, because you have internet, because you have your phone, because you have Google. Many people, what they tend to do is, they'll read online as to, okay, probably I'll start taking Giloy or I'll start taking Ashwagandha or Shilajit for my
Hmm.
problems or something like that, and it'll, solve my issues. But
Mhm.
do you recommend something like that? Can you take? Are there
Definitely
certain
no.
particular things that you can take just to boost your immunity or treat yourself at home, or you should definitely go to a doctor?
I think you should avoid self medication. So this
Hmm.
ashwagandha shilajitu. So the generic properties that they are aphrodisiacs and they boost your vigor and all. But
Hmm.
every drug is having an individual mode of action. You can't be
Hmm.
using ashwagandha very interchangeably with shilajitu because these
Hmm.
drugs are entirely different.
Hmm.
So
Hmm.
they cannot be used interchangeably, and definitely not when you don't know what your condition is.
Hmm.
So just because it has the tag of being aphrodisiac.
Hmm.
So
All right.
and one thing that everybody can do is maintain their agni in normalcy when the
Yeah.
rasa dhatu, that is the first dhatu, is nourished in a proper way. So that actually ahara rasa and rasa dhatu, which
So
is
how do you
pure
maintain
dhatu.
your agni to be a healthy person?
One is that depends on what you eat and how
Okay.
much you eat and
Okay.
the interval, and it mainly depends on what you eat and how much you eat. And
Hmm.
that may need an assistance with some sort of oral medication also. So
Okay.
I think it is better to maintain this agni in good shape. So everything
Hmm.
else, even the sexual problems, to a certain degree, they are also rooted in your
Hmm.
agni and the ahara rasa rasa dhatu.
Hmm.
So once the digestion is not occurring in a proper way, so
Hmm.
there is no nourishment.
All
So
right.
that also, so what
Also,
one can do at home is that, or
okay.
consult
Again,
an authentic.
another question is about, urinary infections are quite common. And how can something as serious as urinary infection in women can be treated, or are there certain remedies that you prescribe as a doctor?
I think I'll not prescribe any home remedies because I'm
Hmm.
totally against that. So what
Hmm.
again that even that comes down to the diet you are following, because it is
Hmm.
generally believed that you drink tender coconut and you'll be fine. You'll not
Yeah,
have a
or
burning
people start
micturition in
having
your.
people start having cranberry juice, or people start having coconut water and ORS and whatnot to treat it.
Sure, that may actually be aggravating the condition, because if
Hmm.
the difficulty in micturition is because of
Hmm.
vata or something called as depletion. In those conditions, using excessive water and tender
Hmm.
coconut would act as remedy.
Hmm.
So that will actually solve the problem. But in most
Hmm.
of the conditions, it is actually caused by pitta and kapha, and there's a lot of accumulation in the body, so which is actually giving rise to UTIs. So in such
Hmm.
conditions, if we are giving excessive water and tender coconut, it is actually going to aggravate the problem. Though you may feel relieved, like transiently, okay, like I'm fine. That's only a temporary relief. That is not even a
Hmm.
relief. So I think we have
Hmm.
to
Hmm.
first pinpoint what is actually causing that UTI. So and
So again,
accordingly,
that brings me. Please, please, please.
Yeah. So accordingly, we can plan the line of treatment with oral medication
I'm
and
saying
therapy.
again, it brings me to the question that, if a woman or even a man has a UTI problem, should they immediately, rush to an allopathic doctor because that's the first thing that pops up in your mind, or can you still go to an Ayurvedic doctor and ask them for a quick remedy as to a quick solution as to medication as to how can I treat it and what can I eat?
I think you should definitely go to an authentic Ayurvedic physician when you have
Hmm.
an episode of UTI. So
All right.
you can expect immediate at least relief and results.
After talking to Dr. Priyanka, one thing I've realized so far in the 45 minutes of the interview that things that even I did not know, that if you have even serious ailments, if you have something that for which you immediately rush to an allopathic doctor, you can actually go to an Ayurvedic doctor as well, and there'll be fast relief even there. All
Correct.
right, and now I have to come to the question of vaccinations. So now there was a time, when we were young, we were small, and there were vaccinations, but there were few. Now
Hmm.
I see the vaccinations that parents are giving to their children, that has become multiple. They're giving like
Hmm.
20, 30 vaccinations in a year and even more. If you go abroad in US and other countries, vaccinations are so strict that if you miss them, then the
Hmm.
doctors uh, give you like a warning, and even governments notice that you're not taking vaccinations on time and stuff like that. But vaccination has a very different way in Ayurveda. So Swarna Prashna, if I'm right, that is the Ayurveda way of giving vaccination. So how is it different from the regular vaccinations?
So I think that's a very important observation that you've made. Like the number of vaccines,
Yeah.
are on a rise. So the problem actually lies with our way of looking at things. We
Hmm,
need quick fix solutions for everything, but which is not
hmm,
possible.
hmm,
And there's also this misconception that immunization can or vaccination can be equated with Swarna Prashna. It is not. Swarna Prashna is much more than vaccines. So
hmm,
the whole idea of vaccination is another way of fragmenting things, fragmented approach. So the ideal way of building immunity or boosting the growth, or at least keeping or maintaining the optimal growth and achieving the milestones of a child, I think it actually starts from the time even before the conception. So when the couple plan for conception, it is from that time that you're contributing to your future child's
hmm,
immunity, the
hmm,
bala, the digestive fire, the memory. So like there is this belief that okay, you have a Swarna Prashana, so you will have this instant boosting of this memory. So that is not the
hmm,
way it works. So it is more so the kind of food that the mother is habituated to, the father also, because they are both equal contributors for the child's
hmm,
birth, and the kind of regimen that the woman follows during the gestation, very very
hmm,
important, and
hmm,
during the sutikacharya, which is the postnatal phase.
hmm,
These are the two things which will directly decide and determine the immunity and resistance capacity of resistance to disease of that child.
hmm,
So this
hmm,
Varna Prashana, again, it cannot be generically given. So that
hmm.
even though is a part of that's actually a part of in the infancy period, you're supposed to actually give Swarna Prashana, but the way it is being given today, that is not the ideal way. Why? Because
Right.
we are not doing this preparatory phase at all. The
Hmm,
gestation, we
hmm,
are not taking care of gestation, we are not careful about what we eat during postnatal period,
hmm,
and
hmm,
suddenly we intervene with this Swarna Prashana. So Swarna
hmm.
Prashana is a nourishing therapy, so which needs to be given in a state wherein the child's Agni is in good shape. Again, it comes
Okay.
down to Agni. So when the
Okay.
child's this thing condition is very receptive, it is only then
Hmm,
that whatever you're giving, it will give fruits. It's
hmm,
actually
hmm,
going to give positive effects.
hmm.
But in wrong conditions, if you're actually giving Swarna Prashana, either it is not having an effect, or it will not give desired effect, or it might even prove harmful.
Okay.
So this
So
sudden intervention, uh,
yeah, please.
yeah. So I think we have to start from there, even before the time of conception. So that will actually decide
So right
the
from the
immunity
time when the
also.
woman right from the time from when a woman conceives, you're saying that, if a woman starts Swarna Prashna and then builds on her,
No, no, I'm not talking about Swarna Prashna. There is a certain there is a regimen which Ayurveda talks about, which a pregnant woman has to follow. And during the conception, it is known as Garbha Samskara, Garbhadana. So when the couple plan to conceive, there is a certain method or certain procedure that needs to be followed. So if a woman is following that procedure, you don't need these external boosters. But I'm not saying that Swarnaprashana is wrong. But the
okay,
kind like it is being practiced today, I think that is not very authentic. So what
okay.
should be given more importance is that
But
having.
if you go to a doctor which is prescribing you Swarna Prashna, and if you're going to a valid doctor, then are you saying that Swarna Prashna can be a substitute to the modern vaccinations that doctors, big hospitals are prescribing you?
I think I know like I know few people who have not who have avoided giving these vaccines. And
Hmm.
also there is this pro and for and against lobby, for and against views, opinions
Right,
about vaccination, because it could be
right.
equally harmful. So that view also is there. So I think the whole idea of like giving a vaccine to prevent, protect ourselves from a disease, I think that idea should be dropped. So when you're following
Hmm.
this whole procedure, you will not need any of those external supports. So that is what I'm trying
Hmm.
to say. So
Okay.
I think we can't be equating the two,
Hmm.
vaccine
Hmm.
or immunization schedule
Hmm.
to
Hmm.
Swarna Prashana. So I think,
But then, if a parent decides to not take vaccinations, which the hospitals or the big doctors are prescribing them, if they completely decide to not take any vaccinations, and if they instead, decide to, after having followed the proper regimen right from the time when a woman conceives, and after that when she starts taking the Swarna Prashna for the child, um, is that okay? Would that help?
that is okay. That is okay. So if
All
assuming that she has followed all the regimen, so the body of the child also will be in a receptive state. So that will actually
okay.
help.
So, because this brings us to the end of this discussion, but because you mentioned, I will ask you the last question. That you said that Swarna Prashna is not being followed in a proper way. You have to go to an authentic doctor. So it brings me to the obvious natural question that how do we understand who is an authentic Ayurveda practitioner? Because in every nook and corner, you see there are so many Ayurvedic doctors now, and especially living in the south, I see so many different Ayurvedic doctors in Bangalore. Uh, which is the doctor which is authentic? What is it that you really need to follow? Because if I'm right to say that Ayurveda is also becoming a quick business to tell you that prescribe herbal medication and you'll be absolutely fine. So what's the right way?
I think it's the most easiest way would be, you can judge someone by, you can ask them a question to prescribe some home remedies. So if a
Hmm,
person is prescribing a generic remedy, generic drug,
hmm, hmm,
and
hmm,
says that it could be it could help every one of you in treating a
hmm.
particular condition, I think then you should doubt the authenticity, because every
Okay.
individual is different. And
Huh.
even though two different individuals have same disease condition, their avasthas, their condition is different. So
Hmm,
you can't be administering one drug to everybody. So I
hmm,
think when someone gives generic prescriptions,
hmm, hmm,
saying that and this television recipes, this recipe is good for that particular disease. So it is
right,
not the
right,
disease that we are interested in. It is the
right.
patient. We're actually
Hmm,
treating and diagnosing the patient. So when
hmm.
someone says that, then I think you should doubt the authenticity.
All right. All right. On that note, I'll end today's discussion. Thanks a lot. You answered many, many questions, and you also answered the very interesting questions on whether a serious bone or a muscle injury can Ayurveda help in that. Also, what can we do about regular hormonal imbalances and urinary infections and stuff like that? What are the common misconceptions? You answered all of them. We even took the interesting question on the use of cannabis, and do our scriptures talk about that or not? Thank you so much, Priyanka Shandilya ji, for joining us today. And thanks a lot for being with us on Bharat Voice.
Thank you so much, Ritika ji, for having me on your show. So it was really nice interacting with you.
Thank
Thank
you.
you.
Thank you.